Bismillahirrahmanirrahim. Last time we discussed about sensory areas in the cerebral cortex. Today about motor areas in the cerebral cortex. Motor areas in the cerebral cortex. Now, what are the methods of investigation of the motor areas? How did we investigate the motor areas? The first method is ablation method. A-B-L-A-T-I-O-N, ablation method. In this method, we damage, destroy a part of cerebral cortex. So a part of cerebral cortex is damaged, and its effects are noted in animals. Effects are noted in animals. So we damage, we destroy a part of cerebral cortex, and then the motor loss or the effects are noted in the animal. This is called the ablation method. The next method is that electrical stimulation of different parts of cerebral cortex. Electrical stimulation of different points, different parts of the cerebral cortex, and noting the movements produced. Noting the movements produced. The third method is study of disease having motor loss, and then its correlation with the post-mortem examination. So study of disease having motor loss, and then after death, its correlation with the post-mortem finding. Right? So these are the methods to investigate the motor areas. Now, different types of motor areas: primary motor area, premotor area, supplementary motor area, and then special motor areas. So primary motor area, premotor area, supplementary motor area, and then special motor areas. Now first about the primary motor area. Primary motor area is located in the precentral gyrus. This is the central sulcus, and in front of the central sulcus is the precentral gyrus. So this area is located in the precentral gyrus on the lateral surface of the hemisphere. Also extends on to the medial surface. Also extends on to the medial surface of the cerebral hemisphere. It also extends into the anterior wall of the central sulcus. Also extends into the anterior wall of the central sulcus. In this area is Brodmann's area 4. So Brodmann's area 4 is the primary motor area. Area 4 is the primary motor area. In the primary motor area, the cerebral cortex is agranular. So agranular type of cerebral cortex. It means pyramidal layers are well developed pyramidal layers, and granular layers are poorly developed. So poorly developed granular layer and well developed pyramidal layers. In this area, there is topographical representation of the body parts. Topographical representation of the body parts. Different body parts are represented in the primary motor area. And this representation of body parts is contralateral. I mean, the right side of the body is represented in the left-sided motor area, and vice versa. So contralateral representation, and then there is upside down representation. So contralateral representation, and there is upside down representation. You see, this is the lateral surface of hemisphere. The lowermost part concerned with chewing, swallowing, tongue, jaw, lips, tongue, and so on. Now, by electrical stimulation of this area, regarding the body parts representation, a figure of the body is formed. A figure of the body is formed see, by point-to-point electrical stimulation, a figure of the body is formed that is called motor homunculus. So motor homunculus is formed in the primary motor area. Motor homunculus. Now we discussed the sensory homunculus in the somatic sensory area 1. Sensory homunculus. This is the motor homunculus in the primary motor area. Now you compare the motor homunculus with the sensory homunculus. Motor homunculus is the mirror image of the sensory homunculus. Mirror image of the sensory homunculus is the motor homunculus. Our sensory homunculus is in the post-central gyrus, that is somatic sensory area 1, while the motor homunculus is in the precentral gyrus, that is the primary motor area. You see the motor homunculus. This is the lateral surface of cerebral hemisphere, the medial surface. You see in the lateral surface, in the lowermost part, you see the tongue, then lips and jaw, of course face, then you see thumb, fingers, hand, arm, you see trunk, thigh, leg, and foot. You can see that foot and genital organs are on the medial surface of the cerebral hemisphere. You see, foot and genital organs are on the medial surface of cerebral hemisphere. This is the motor homunculus, which is the mirror image of the sensory homunculus. Right? Now here also you can see that area of representation of some parts of the body is larger as compared to the anatomical size of the part. So area of representation of some parts of the body is larger than the size, anatomical size of the parts of the body. You see, tongue, lips, thumb, fingers, hand, and then toes. These occupy much larger area. I can say that area of representation of different parts is not according to the anatomical size, but according to the physiological importance. Keep in mind, parts of the body involved in fine precise, skilled movements occupy larger areas. Parts of the body involved in fine, precise, and skilled movements occupy much larger area of representation. You see, tongue occupy larger area. Lips, and tongue and lips are used in speech. They're used in speech, right? So these occupy tongue and lips, occupy face, occupy much larger area. And then you see thumb, fingers, and hand. You see, fingers and hand are used in writing, in cutting designs. So these parts are involved in fine skilled movements. Fine skilled movements, so hence occupy much larger area of representation in the primary motor area. I told you there is contralateral representation of the body parts. But face has some bilateral representation. Face has some bilateral representation. Right? Now, when we stimulate primary motor area, there are coordinated movements of contralateral parts of the body. So we stimulate primary motor area, there is coordinated movements of contralateral parts of the body. Now, moreover, it has been seen that when we move a part of the body, say I move my right hand, blood flow to the hand representation area in the motor cortex increases. I move my right hand, blood flow in the hand area, in the motor cortex, it shows increased blood flow. Increased blood flow, of course, in the left motor cortex. Right? Now, about the connections of the primary motor area. Connections of the primary motor area. First, about the afferents. So, afferents from premotor area and prime motor area of the other side. So afferents from the premotor area and prime motor area of the opposite side. Then afferents from somatic sensory area. Afferents from somatic sensory area, visual area, auditory area, and then afferents from thalamus, basal ganglia, and cerebral. So afferents from the premotor area, primary motor area of the opposite side, somatic sensory areas, visual area, auditory area, afferents from the thalamus, basal ganglia, and cerebellum. These are the afferents which come from these parts to primary motor area. Now the efferents from this area go to spinal cord as corticospinal tracts. So efferents go to spinal cord as corticospinal tract. Then corticobulbar tract from cerebral cortex, from the motor area to the motor nuclei of cranial nerves, and then corticothalamic fibers to thalamus, corticopontocerebellar fibers from cerebral cortex. From the prime motor area, fibers go to the pontine, to pons, and then to cerebellum. And then corticostriate fibers from corpus striatum corticostriate. So from the motor area to the corpus striatum to basal ganglia. So corticostriate fibers. So corticospinal, corticobulbar, corticothalamic, corticopontocerebellar, and then corticostriate fibers. So this was about the connections of the primary motor area. Now we come to the premotor area. Premotor area. A premotor area is located anterior to the primary motor area. Anterior to the motor area is premotor area. Premotor area. It's broad above and narrow below. Broad above and narrow below. Premotor area is Brodmann's area 6. So Brodmann's area 6 is premotor area. Premotor area. So premotor area anterior to the prime motor area. It is Brodmann's area 6. In premotor area, there is also body parts representation. There is also body parts representation in the premotor area, Brodmann's area 6. Premotor area, it occupies superior, middle and inferior frontal gyri. Occupy superior, middle and inferior frontal gyri. Superior, middle and inferior frontal gyri is occupied by the premotor area. Premotor area, when stimulated, results into movements involving groups of muscles. When we stimulate this area, there are movements involving groups of muscles. This area, premotor area, it stores programs of motor activity with the help of the past experience. It stores programs of motor activity with the help of the past experience. This area is involved in the control of complex pattern of motor activity. Involved in the control of complex pattern of motor activity. Involved in the control of complex pattern of motor activity. We can say that premotor area programs activity of the primary motor area. Premotor area programs activity of the primary motor area. Premotor area is connected to the primary motor area directly or through basal ganglia and then through thalamic nuclei, right? So premotor area is connected to the prime motor area directly or through basal ganglia and thalamic nuclei to the primary motor area. So this was about the premotor area, which programs activity of the prime motor area involved in the control of the complex pattern of motor activity. Next motor area is the supplementary motor area. Supplementary motor area. It is located anterior and superior to the premotor area, anterior and superior to the premotor area is the supplementary motor area. It is located on the medial surface of the cerebral hemisphere. Located on the medial surface of the cerebral hemisphere. Medial surface of cerebral hemisphere. It occupies medial frontal gyrus. Occupies medial frontal gyrus. Located just above the cingulate sulcus on the medial surface. Located just above the cingulate sulcus on the medial surface. In this area, body parts are also represented. In this area, body parts are also represented. Face is anterior, legs are posterior, face is anterior, legs are posterior, back is towards cingulate sulcus. Back is towards cingulate sulcus. And other parts are above. Other parts are above. This area has bilateral connections. I mean connections with both sides of the body. Connection with both sides of the body. Bilateral connection with the body parts. This area is involved in the control of attitudinal or positional movements. Attitudinal or positional movements. Attitudinal or positional movement. I give example. A person wants to climb up. Person wants to climb up. What will be the attitude, position to climb up? Of course, hands are like this, face, eyes are like this, and the hands get hold of some support, and then the person can climb up. Now in this climbing up, what is the attitude, position? This is the attitude position. In this positional or attitudinal movement, there is involvement of the supplementary motor area. So control of the positional or attitudinal movements with involvement of the supplementary motor area. So this was about the prime motor area, premotor area, and supplementary motor area. Now we come to special motor areas. Special motor areas. So the first of special motor areas is Broca's area. Broca's area. Also called motor speech area. Motor speech area. Located in the posterior portion of inferior frontal gyrus. Located in the posterior portion of inferior frontal gyrus. Inferior frontal gyrus. It is Brodmann's area 44. So Brodmann's area 44 is the Broca's area. Broca's area. You see, it is anterior to the face area, anterior to the face area in the primary motor area. Anterior to face area in the primary motor area. This area receives signals from Wernicke's area through arcuate fasciculus. So Broca's area receives impulses from the Wernicke's area through arcuate fasciculus. You know Wernicke's area is sensory speech area. Broca's area is motor speech area. So it receives impulses from Wernicke's area, sensory speech area, through the arcuate fasciculus, a bundle of nerve fibers. So what is the function of this Broca's area? Formation of detailed motor pattern. Formation of detailed motor pattern for the contraction of muscles of phonation and articulation. So formation of detailed motor pattern for the contraction of muscles of phonation and articulation. So these pattern or the muscles of phonation and muscles of articulation will contract. This pattern is formed, its details are formed in this area, and then impulses from Broca's area go to the primary motor area to initiate contraction of the muscles of phonation and articulation. Impulses go from Broca's area to primary motor area to initiate contraction of muscles of phonation and articulation. I used the word phonation and articulation. Phonation, production of voice or sound, which occurs in the larynx. And vocal cords vibrate to produce voice or sound. That's called phonation. So vocal cords vibrate to produce voice or sound, and this is called phonation. Then is articulation. Articulation, that is formation of words from voice or sound produced in the larynx. Formation of words from the sound produced in the larynx. What are the organs of articulation? Tongue, lips, soft palate. Teeth also have. So tongue, lips, soft palate, and teeth also have in articulation. So in articulation, words are formed. Words are formed from the sound voice produced in the larynx. So details of pattern of contraction of muscles of phonation and articulation is formed in the Broca's area, that is the motor speech area. If Broca's area is damaged, there is non-fluent aphasia. So non-fluent aphasia, when there is damage to Broca's area. Non-fluent aphasia. Patient feels difficulty in uttering words. Patient feels difficulty in uttering words, emitting words. Speech is slow. Speech is slow, non-fluent. Speech is slow, non-fluent, and difficulty in uttering, emitting words. That's called non-fluent aphasia. The region is in the Broca's area, motor speech area. Now, other special motor area is frontal eye field. Frontal eye field, located in the middle frontal gyrus, Brodmann's area 8, it's Brodmann's area 8 in the middle frontal gyrus. Electrical stimulation of this area results into movements of eyes towards the opposite side. So electrical stimulation of this area results into conjugate deviation or eye movements to the opposite side. Conjugate deviation or eye movements to the opposite side. So frontal eye field, area 6, it causes conjugate deviation of eyes towards the opposite side. This area also controls movements of the eyelids. Say blinking. So movements of eyelids or blinking is also controlled by this area. This area also controls voluntary fixation of eyes from one object to the other. It controls voluntary fixation of eyes from one object to the other. From one object to the other. Now when there is damage to this area, frontal eye field, person is not able to fixate eyes from one object to the next, to the other. So failure to fixate eyes voluntarily on objects when there is damage to this area. So failure, inability to fixate eyes voluntarily from one object to the other when there is lesion of this area. So this was about the frontal eye field, Brodmann's area 8. Next is the head rotation area. This area controls the head rotation. It controls the head rotation. Next is area for hand skills. Area for hand skills. Area for hand skills. Right? So this area controls the skilled movements of hand. It controls the skilled movements of hand. Now when there is damage to this area, it results into motor apraxia. So motor apraxia occurs when there is damage to this area. Motor apraxia. Now in motor apraxia, which results to damage to the hand skill area, the hand movements become incoordinate and purposeless. So hand movements become incoordinate and purposeless. So without any purpose, hand moves. So hand movement becomes incoordinate and purposeless when there is damage to the hand skill area in the frontal lobe. Right? And this is called motor apraxia. Motor apraxia. So this was about the motor areas in the cerebral cortex. I discussed the primary motor area, area 4, premotor area, area 6, supplementary motor area on the medial frontal gyrus, and then special motor areas including the Broca's area, motor speech area, frontal eye field, which controls the blinking eyelid movements, voluntary fixation of the eyes, right? And then area of head rotation and area for the hand skills we discussed.